Hey everyone, welcome back to another video. Today, we're going to delve into a common condition that affects many people, tennis elbow. In this video, we'll explore what tennis elbow is, the anatomy of the elbow, what symptoms are generally expected, the typical treatment options, and how to prevent it. I also want to do a follow-up video discussing what you can try if you are suffering from tennis elbow and have had treatment, but it hasn't improved. But first, let's get into this video. Tennis elbow, also known as lateral epicondylitis, is a painful condition that occurs when the tendons of the forearm, located at the outside part of the elbow, become inflamed. It's often a result of overuse or repetitive motions of the forearm and wrist. We commonly see it in sports such as tennis, badminton, squash, or with jobs that involve activities like repetitive gripping, lifting, or using tools that require force that can strain these tendons. Repeated strain and increased usage of these muscles and tendons can lead to micro tears and inflammation. Despite its name, only a small proportion of people who suffer from tennis elbow actually receive this injury from tennis. To better understand this condition, let's have a closer look at the anatomy of the elbow. The elbow is made up of three bones: the humerus, which is the bone of the upper arm, which comes from your shoulder down to your elbow, and then two bones in the forearm, which is your ulna and your radius. On the image, you won't be able to see exactly where these bones are, but I'll briefly point them out now. The ulna sits on the pinky side of the forearm, and that runs roughly along here. And the radius sits on the thumb side of the forearm, and that will run on this side here. The humerus will run from up here down towards this part of the elbow. Now, tendons and muscles will connect onto these bones. In the case of tennis elbow, we're looking at the extensor group of muscles, which sit along here. There's quite a few of them, but they all run up towards the same part of the elbow, which form the common extensor tendon, sitting up here. These muscles will commonly affect movements involving the wrist and the fingers. As you can see, these tendons run down all the way into these fingers. And because they are the extensor muscles, they will generally affect movements including wrist extension and finger extension, and also gripping. And in addition to the extensors being affected, the muscles that perform a movement known as supination can also be affected in tennis elbow. And a main muscle that does supination is your anconeus here. Commonly, symptoms will include pain along the outside portion of the elbow, which often starts during or after an activity that has caused this injury. This is usually really tender to touch and can often ache as well. We usually see an increase in pain when we test movements such as a resisted wrist extension or finger extension due to the location of those muscles which are affected, as well as gripping or making a fist. And this will also affect simple actions such as holding a bottle of water, or pouring a full kettle, or wringing out a wet cloth. And if you're suffering from tennis elbow, you might find that one or all of these movements are painful for you to do. Now, let's discuss the typical management of tennis elbow. This is what most physios would recommend when they see a presentation of tennis elbow. As tennis elbow is an overuse injury, the most common advice is to rest from any aggravating activities, and also to use ice as a method to reduce excessive inflammation. Ice is generally useful as a temporary pain relief, especially early on when the injury first occurs. Ice is also great for any time a flare-up might occur if you accidentally overuse your injured arm. You can ice the elbow for about 15 to 20 minutes of the nighttime before going to bed. It's also possible to offload some of the strain on the tendons by using braces or strapping or taping. These work by placing pressure on the muscle belly of the extensor muscles, which creates a closer anchor point from which the muscle can contract. As such, this allows for the contraction of the muscle without putting excessive load onto the recovering tendon. These are often useful for people who are unable to completely rest from the activities that had aggravated them in the first place, whether that is work or sport. Exercise is a crucial part of treatment when it comes to tennis elbow. It includes stretching and strengthening exercises, which help improve the flexibility and the strength of the forearm muscles and tendon. Let's have a look at what some of these exercises might be. Firstly, wrist extension will be important to train due to the fact that it is often the main muscle group that is affected when it comes to tennis elbow. I'll go through several ways in which you can train your wrist extensors throughout different stages of your rehabilitation. In the early stages of your rehabilitation, it might be too painful for you to move your wrist up and down. If that is the case, you will want to start on something known as isometric exercises, which will involve contraction of the muscles without actual movement of the wrist. To do this, rest your injured forearm on a suitable surface, whether that's your armrest, your table, or your thigh, and place your good hand on top of the hand on the injured side. Gently press down with your good hand and resist the movement with your injured hand. Only apply as much pressure with the good hand as you can handle without pain. You can hold the pressure for about 2 seconds before releasing slowly. You will want to perform this exercise until you get to the point where you can move your wrist without any pain. Once you can do so, you can move on to the next exercise. To make it slightly harder, we'll be using a small weight for the next exercise, about half or 1 kilogram. The setup position will be almost exactly the same as the previous exercise, with your forearm resting on a suitable surface with your wrist hanging slightly off. This time, however, we'll be contracting your muscles and moving your wrist up and down. And so holding onto the weight, lift up your wrist as much as you can without any pain, and then slowly lower it back down to the starting position. As you get stronger, you can increase the weight that you are holding. This is one way to challenge your wrist muscles as they improve in their strength. This exercise can also be challenged by introducing a speed component to the movement. To do this, lift your wrist faster and lower slower than before. You will want to do this with a light weight to begin with, before increasing your weight again. For most daily activities, a good goal to aim for is to be able to lift 2 to 3 kilos comfortably, but this may change depending on your situation and your usage. Another muscle group to train would be your forearm supinators, as mentioned before. To do this, use a hammer or something similar. You want something that has a weighted top for this motion. Holding the bottom of the hammer with your thumb pointed up towards the ceiling, rest your forearm on a suitable surface. Slowly let the hammer fall down to one side, controlling the movement. When it has moved 90 degrees, bring it back up towards the middle, and then slowly go towards the other side. This will force your arm to rotate while controlling a falling weight, and this will work your supinators and pronators. Next is to train your grip strength. You can do so with regular household items such as a soft stress ball or a clean kitchen sponge, before progressing onto a slightly more difficult exercise, which will be practicing wringing a towel. And this is easily accessible for most people and will challenge your grip strength and wrist motion together. Start with a small cloth or a tea towel and make it more difficult by using a thicker towel or having more layers in your grip. If you have access to them, using some spring-loaded grip trainers would also be very useful. Stretching can also be really helpful when it comes to dealing with the tension in the forearm. Interestingly, for tennis elbow, which causes pain on the outside part of the elbow, it is useful to stretch the muscles on the opposite side. This is to ease the strain that may come from the flexor muscle group, as they are constantly interacting with the extensor muscles in any wrist actions or usage. If the flexor muscles are too tight, they will put more load on the extensors, and thus adding more strain to an already injured tendon. To perform this stretch, turn your palm upwards and hold your elbow straight. Gently pull your hand down with your other hand until you feel a stretch running up your forearm. Hold it there for 30 seconds. You can stretch the extensor muscles as well, and this is performed almost the same way, just with your palm turned down instead of up. If a conservative approach doesn't help relieve symptoms, your healthcare professional may recommend other options, such as a corticosteroid injection. The injection works by flushing the area of excessive inflammation. By doing this, it can often give the tendons enough pain relief to begin exercising and loading without pain, to start healing and the rehabilitation process. This isn't 100% effective, however, and in cases where it doesn't help, it may mean that the inflammation around your elbow is being caused by something else. I'll go into this more in another video, talking about what happens when typical management doesn't work. Back to regular tennis elbow though, as with all overuse injuries, prevention is key. To reduce the risk of developing tennis elbow, practice proper form in repetitive movements, use ergonomic tools if you can, and take regular breaks. As you have a better understanding of what causes and helps tennis elbow, you can also perform the exercises in this video to help future-proof your elbow from being injured. That wraps up our video on tennis elbow. Remember, early diagnosis and appropriate treatment is essential to making a good recovery. As always, if you are suffering from this injury or are experiencing ongoing symptoms, consult with a healthcare professional or physiotherapist for an accurate diagnosis and a personalized treatment program. If you have enjoyed this video or found the information in this video helpful in any way, please hit the like button and leave me a comment down below. I do read all your comments and I thoroughly enjoy them. And if you haven't done so already, subscribe to stay up to date for more videos on tips to looking after your body and health. Thank you so much for watching, and I'll see you in the next video.